And for a better learning experience, please download our app available for Android and iOS or join the channel membership. The link for everything is given in the description of this video. The important points which are usually missed during the preoperative analysis. There are three branches and the superior and inferior pancreaticoduodenal arcades. So I the surgery while doing the uncinate first approach. So again you have to remember this anatomy as a common trunk from the repeat the sequence and you can relate it better. So that means while doing the artery this uncinate and approaching the SMA, you will encounter the this IPDA and the first jejunal as a common trunk, and just below there will be the second jejunal artery, and it is important to analyze this anatomy with your friends. And